Hello. Welcome to my vlog. Welcome to my class. So this is going to be medical ward, BSN 3F group number 1. So we will be having our virtual tour of duty at Maria Reina Xavier University Hospital, Station 2A, and of course we will be on an AM shift. But of course, since we are currently experiencing this pandemic, we will be having our case analysis, and of course our focus is going to be diverticulitis. This is yours truly, Mr. Joseph Bahian Abang, your clinical instructor for this rotation. I am here for you. It's literally my life's work to help you grow. This statement is very important because, of course, this tells us that everyone is here because, of course, we will be growing together. In order for us to make sure that this virtual duty is going to be meaningful, this will be our guide for our learning outcomes. On the completion of this case study, student nurses will be able to, first, build knowledge related to the patient's medical experience. Number 2, continue to develop a comprehensive assessment and monitoring skills. Number 3, recommend nursing interventions based on the case presented. Number 4, define the roles and the contributions of student nurses in the care of medical patients. And number 5, justify optimal therapy based on the current understanding of the case. So this will be the guidelines, or this will be the expected learning outcomes that we will actually get after learning this diverticulitis together. Please be guided with the following instructions in the making of this case scenario. First, all critical thinking questions presented within or after the case applies to this case study. Second, you have to create a brief and to-the-point responses. No flowery words. Third, when asked to provide several answers, it must be listed in order of priority or level of significance. Fourth, base all your answers on the data that is presented and do not assume information that is not provided in the case. Next, please follow the format of your output, especially on its font style, font size, paper margin, and paper size. So I will be sending, or I have sent already the format of the requirements that you're going to submit that focuses on the daily requirements and also for the weekly requirements. Next, save it as PDF file and submit all your requirements per group on date specified as its deadline. Next, send all your requirements via the official email address of your clinical instructor. So the email address will be reflected on the last slide of this presentation. Next, it is advised that you will submit all your requirements on or before the set deadline of submission. Let's now have the case scenario of patient AB with diverticulitis. This is his history. AB, a 30-year-old call center agent, a Roman Catholic in faith, single, Filipino citizen from Lagait, Misamis Oriental, has come to the gastroenterologist of MRXUH for consultation regarding his recurrent mild to severe abdominal cramping and presence of blood-streaked stool. You are the student nurse doing his initial workup under the supervision of your clinical instructor. Based on your findings, AB is a mildly obese man who demonstrates moderate guarding of his abdomen with both direct and rebound tenderness, especially in his left lower quadrant. You took his vital signs and recorded it as follows: BP of 168/98 millimeters mercury, heart rate of 110 beats per minute, respiratory rate of 24 cycles per minute, and temperature of 100.4 degrees Fahrenheit or 38 degrees Celsius. He was observed as slightly diaphoretic. AB reported that he has a periodic episodes of constipation. He further stated that he had previous episodes of abdominal cramping, but this time, the pain is getting worse. Past medical history reveals that AB has a sedentary job with lots of emotional moments. He has smoked a pack of cigarettes a day for 12 years, and he has had 2 or 3 mixed in the evening. Until 2 months ago, he states, "I haven't had anything to drink in 2 months." He denies having a regular exercise, just no time. His diet consists mostly of white bread, meat, potatoes, and ice cream with fruit and nuts over it. He denies having a history of cardiac or pulmonary problems and no personal history of cancer, although his father and older brother died of colon cancer. He takes no medications and denies the use of any other drugs or herbal plants. At around 9 a.m., AB was seen and examined by Dr. CD with orders of X-ray KOB, or the kidneys, ureters, and bladder, CBC, or the complete blood count, and complete metabolic profile. As his student nurse, you carried out the orders of his physician accordingly. Based on X-ray and lab findings, physical examinations, and history, Dr. CD diagnoses AB as having acute diverticulitis, and this causes an outpatient treatment plan with him. The following day, AB was seen and examined by Dr. CD with orders of may go home and was discharged with prescriptions for metronidazole or Flagyl, 500 mg PO every 6 hours, ciprofloxacin or Cipro, 500 mg PO every 12 hours, dicyclomine or Bentyl, 20 mg QID PO for 5 days. To help AB work through his dietary concerns, you obtain a referral to a registered dietitian. AB returns for a checkup 14 days later. All signs and symptoms of diverticulitis are gone. He is working on his lifestyle changes and reports he is walking 30 minutes every day. And that is the case of AB with acute diverticulitis. Let us proceed now to the critical thinking questions. You need to answer this one as brief as possible. First, identify 4 general health risk problems that AB exhibits. Number 2, identify a key factor in his family history that might have profound implications for his health and present state of mind. Number 3, identify 3 key findings on his physical exam and indicate their significance. Number 4, what is diverticulitis? What are the consequences of untreated diverticulitis? And lastly, number 5, while the patient is experiencing the severe crampy pain of acute diverticulitis, what interventions would you perform to help him feel more comfortable? So these are the 5 critical thinking questions that you need to answer, and as much as possible, present your answer as brief as possible. Let us proceed now on the daily duty requirements. For day 0 means that's gonna be if our duty is on a Monday and Tuesday, we'll have day 0 for Sunday, and that's going to be the case scenario loading. So the requirements will actually be given, and you need to submit your requirements for day 1. And for day 1, you are going to submit the general objectives, the specific objective, daily plan of activity, duty expectations, physical assessment, the pathophysiology, the drug study, and the nursing care plan. And for day 2, of course, you are going to submit the specific objectives, daily plan of activities, the survey for day 1, sample nurse's notes, FDAR of day 1 and day 2, and discharge plan. Included is your reflective journal reading. And for week 1, the deadline for this will be within the week. You have to follow the case study written requirements. Case study requirements, and these are the following. You have to have a simple introduction, and then it will be followed by the nursing health history, physical assessment. Next is anatomy and physiology. It will be followed by pathophysiology. And after the pathophysiology is your diagnostic tests. And after that is your drug study. And it will be followed by the problem lists. And of course, your nursing care plan. And of course, after your nursing care plan, it will be followed by the discharge plan, learning outcome, and of course, the most important also is the references. And please do follow the APA style of reference taking. For the deadline of submission, for day 1, the deadline is February 1, 2021, Monday, and that has to be up until 11:59 p.m. of that day. For day 2, the deadline is February 2, 2021, that's Tuesday, that is going to be until 11:59 p.m. And for week 1, wherein you are going to submit that one within this week, and the deadline is going to be February 6, 2021, and that's going to be Saturday, 11:59 p.m. We are all on our journey, but in this class, we all need one another and will help one another to grow. These are my details of the things that you are going to bear in mind, especially on my email address. My email address is jabang@xu.edu.ph, and of course my mobile number is 0931-042-9842. This has been Yucef Bahian Abang at your service to make your best better. Thank you. See you virtually soon. Bye. To God be all the glory.